Okay, let's dive right into this. Welcome to today's Explainer, where we are going to totally unpack the fast-paced, sometimes chaotic world of the medical biller. I've always kind of wondered how a standard doctor's visit actually turns into a real paycheck for the clinic, or how patients even figure out what they owe. Well, today we're exploring the medical biller's blueprint, breaking down exactly how they act as that absolutely vital bridge between clinical treatments and financial reimbursement. Here is our blueprint for today. We've got 1. Coding versus billing fit. 2. The medical biller's role. 3. Navigating healthcare payers. 4. Essential claim forms. And finally, 5. Pre-submission claim audits. All right, let's get moving. Section 1. Coding versus billing fit. Before jumping into the nitty-gritty of the day-to-day tasks, there's a pretty crucial crossroad you'll face as a healthcare administrative student. Are you a coder or are you a biller? And listen, this isn't just about what you think you want to do. It's really about how you naturally like to work. I mean, do you prefer working quietly and independently, just diving deep into data and text? Or do you actually thrive on solving problems dynamically while talking to real people? Let's break down exactly what each persona looks like based on our source material. The contrast here is pretty fascinating. So, a medical coder, they need to be incredibly detail-oriented and just a really strong reader. They're spending the vast majority of their time interacting with their computer, carefully analyzing physician notes and translating all of that into alphanumeric codes. Most coders literally don't work with patients at all. But on the flip side, the medical biller is highly interpersonal. If things don't go as planned, and let's be real, that happens, and a patient gets a confusing bill, it's the biller who has to pick up the phone. Billers need a massive dose of empathy and top-notch communication skills to explain tricky financial stuff like coinsurance or co-payments to patients who might be super stressed out. Basically, you are the face or the voice of the office's billing department. Section 2, the medical biller's role. Now, what's really interesting about this next slide is what a biller actually does once the coder finishes their part of the puzzle. At its core, the medical biller is a conduit. You are the essential link connecting patients, medical professionals, and insurance firms. Think of yourself as a translator. While the coder translates medical procedures into codes, you, the biller, translate those codes into a comprehensive financial report. You're the one making sure the whole financial story actually makes sense to both the insurance company and the patient. So, on a daily basis, what does that look like? Well, it means executing a very specific set of core responsibilities. You're going to submit invoices to both patients and insurers. You'll be using specialized billing software to make sure you're applying the correct billing formats and attaching any necessary documents. You're also totally in charge of ensuring proper modifiers are applied to the claim. These are those specific codes that give insurers more context about a procedure. And of course, you'll be managing patient communication regarding things like co-payments or even their inability to pay, really helping them navigate their financing choices. Ultimately, all of this hard work leads to one absolute primary goal: securing timely payment for accurate claims. Your meticulous work is what ensures that the healthcare practitioner is fairly reimbursed and actually compensated for the crucial services they provide. Look, if the biller doesn't do their job correctly, the doctor doesn't get paid. It's literally that simple, and it's for sure that important. Section 3, navigating healthcare payers. Let's move to the next part and see how this builds. Because to get those timely payments, we really need to know exactly who we are billing. We can group this pretty complex web of payers into 3 main digestible categories. First up, commercial insurance. These are your private carriers, handling plans like PPOs, HMOs, and point-of-service plans, the stuff the majority of employers provide. Second, we have networks and TPAs, or third-party administrators. These guys often act as middlemen that price claims on behalf of commercial payers. And third, government payers. This includes massive programs like Medicare for eligible seniors, Medicaid for lower-income populations, and TRICARE for military members and their families. And yeah, every single category has its own distinct rules for what's covered and how providers actually get paid. Let's zoom in on one of the more unique entities for a second, the TPA. Third-party administrators manage insurance coverage for companies that actually choose to self-insure their workers. Now, you might be wondering, why do companies do this? Simple: to keep costs low. The small business essentially acts as the insurance carrier itself, paying providers directly from a company bank account, but they hire a TPA to handle the actual processing and pricing of the claims. As a biller, here's the catch. If a claim is priced incorrectly by a TPA, you have to know to contact the TPA to fix it, not the employer. Section 4, essential claim forms. All right, now that we know who we're billing, let's look at the actual tools of the trade. In medical billing, there are two absolute heavyweights you need to differentiate clearly. On one side, we have the CMS 1500, also known as the HCFA form. This is the standard professional claim form used for your everyday physician office visits and clinical outpatient centers. On the other side is the UB04, or CMS 1450. This is the institutional form, and it's strictly used by larger facilities like hospitals, rehabilitation centers, and ambulatory surgical centers. Knowing exactly which form matches your provider environment is a fundamental skill. And if you want to see just how complex facility billing can get, just take a look at this UB04 form. It contains a staggering 84 individual boxes. No joke. On top of the standard info you'd find on a physician's form, the UB04 has mandatory areas for specific revenue codes, bill types, and sometimes value codes. It requires a highly trained eye to ensure every single box accurately reflects the facility's services. Section 5, Pre-Submission Claim Audits. Which brings us to the high-stakes final step. This is the absolute last line of defense before a claim is pushed out to an insurance company, a strict verification routine. Step 1, you confirm whether the payer requires a paper or electronic submittal. Step 2, you thoroughly, and I mean thoroughly, examine the claim to confirm that absolutely all pertinent medical codes and patient info are there. Step 3, ensure that any payer-specific or provider-specific modifiers are correctly applied. So the crucial point is that this routine has to be rock solid. I want to leave you with this exact quote from the source text because it really perfectly defines the accountability of the role. It says, "It is ultimately the biller's responsibility to ensure that payer-specific modifiers are included on the claim before its submission." Let that sink in. Even if a medical coder was the one who initially applied the modifiers based on coding rules, it is you, the biller, who takes final ownership. You are the gatekeeper. Your scrutiny is what ensures the claim won't bounce back rejected, saving your whole facility from lost revenue and delayed payments. When you stop and realize just how much rests on the medical biller's shoulders, from untangling super complex insurance networks to scrutinizing those wild 84-box forms, you really have to ask, could the entire healthcare system survive even a week without them? Please like, share, and subscribe to Decode Healthcare with Harshal.